How did you describe to the patient what you were going to do?
I didn't describe to the patient
Did
what
you
I was
describe
going
to
to
the
do.
aide what you were going to do?
I think I said to her, I think there might be an infection there, and, perhaps I'd best, take some of that tissue down and submit it into the lab.
Now, you knew that that aide did not have a healthcare proxy for Mrs. Geschwind.
I didn't know that. She made it, no, she didn't have a health care proxy.
So you knew that she could not consent to any procedure that was going to be done on Mrs. Geschwind.
Yeah, I knew that she couldn't consent to it.
And you knew that Mrs. Weiss was not present. And you knew that she could consent, and you knew that you couldn't have a conversation with Mrs. Geschwind,
Right,
correct?
right.
So nobody consented to this procedure.
I felt that before I left that house, I would be negligent if I did not do what I could to try to improve the condition of that toe.
But I'm asking you specifically, did
I-
anyone, doctor, let me ask the question, did anyone with the ability to consent to that procedure before you did it?
No, they didn't.
Doctor, I want to talk about the sterile technique that you employed when you did this procedure on Mrs. Geschwind. To begin with, tell me exactly what procedure you did.
I did a debridement of an ulcer, right second hammer toe.
So, in terms of what we discussed early on in this testimony, this would be considered surgery because it's cutting the skin, right?
Yes, I mean, much like a corn is, even a corn is considered surgery.
So, you have to make sure that you employ a sterile technique.
As sterile as one can get, which oftentimes is not sterile because I'm not in a hospital operating room, and sometimes even in a hospital operating room it's not quote-unquote totally sterile.
So, what sterile technique did you employ?
I wiped the toe down with alcohol, rubbing alcohol, and I think I might have put some betadine down first, and then I wanted to get the betadine off of there, and then I followed up with alcohol.
You said you might have put some betadine down. Do you know if you put betadine down?
I think I put both alcohol and betadine. I put the betadine down, I got it off real quick, I put some alcohol on it.
You don't actually have an independent recollection of doing this that day. You're talking about what your standard practice would be?
My standard practice would probably be wiping it down with betadine, but she had a suspected iodine allergy. I didn't want to keep the betadine on there too long, so I followed up with the alcohol.
Do you remember doing that?
Yeah.
You have a specific recollection of that?
Right.
Where was the aide when you were doing that?
She was right there.
Let me ask you this. You're telling me that you performed this procedure in order to determine if there was an infection, right?
Right.
So you knew there was a possibility that there was an infection, right?
I knew there was the possibility.
What did you do about the dirty sheets before you performed this procedure where you were going to be opening the skin of this woman?
I don't even know that I didn't have something that I put down under her foot. I don't know that.
But you don't know if you did, do you?
I don't know if I did.
And after you were done, you don't know if you left a bandage on it, but you do know you left her in the bed in the sheets that were there, right?
That's correct.
Now, you said that you did not go back to see Mrs. Geschwind because you were contemplating leaving practice. Now, Mrs. Weiss got in touch with you early on after this procedure was done, right?
I think it was on the 6th of March that I talked to her.
And at that time, did she ask you to come back and look at her mother?
No.
Did she tell you her mother was not any better?
Yes.
And did you have confirmation that there was an infection?
I don't. even to this day, I can't say with 100% conviction that it was an infection.
Well, you had lab reports that showed it was an infection.
I had
Injection,
lab reports that showed that there was Staph aureus there, okay? But I didn't have any white blood cells in the gram stain to indicate that there was an infection. But considering her frailty, her circulation, I felt if I would best do something than do nothing, and that's why I put her on the antibiotic.